Certified Feldenkrais practitioner, a certified Rolfer, and author. He graduated from the University of Washington School of Law in 1995, and while working as an attorney, he developed chronic neck and back pain, but eliminated it through movement therapy, exercise, and body work. And in the process, he developed a passion for understanding chronic pain and its relationship to movement, and then using this understanding to help others. In 2005, he quit his career as attorney to pursue his interest in helping others with movement. And since then, he's been practicing as a massage therapist and Feldenkrais practitioner in Seattle. He has a blog that you can find at bettermovement.org, which focuses on applying a modern understanding of pain science and neuroscience to movement-based therapies. He has a lifelong interest in sports and has competed in tennis, ping pong, billiards, soccer, and squash. He also has a broad interest in a wide variety of movement disciplines and has published 2 books, Better Movement and his latest, most recent book, Playing with Movement. So welcome to the online summit, Todd. Thank you so much for joining us.
Thanks for having me, Raja.
And I guess I'll just kick off with from a clinical perspective, if we're adding movement into a treatment protocol for our patients, what would be the differences in approach between a mechanical versus a more holistic viewpoint?
Yeah, I think the mechanical viewpoint is more about isolating one particular small problem in the body and then kind of going at that in kind of like an impersonal kind of a way. So your therapy would be the same for everybody, no matter what their preferences or motivations or interests, if they all had what you thought was the same kind of local, isolatable pathology in the body. But a more kind of like, if you're working more on the human level or thinking more about the person, you'd be very interested in, hey, what do you like to do? What kind of movements appeal to you? Which ones would you show up for? What kind of environment are you in, and which kinds are available in your house and stuff like that. And what the research shows, it's very often the case that just moving or doing general exercise works just as well for something like back pain or other kinds of problems as a very isolated, targeted, kind of diagnosed, prescribed plan for moving better. So that's why you really want to get to know the person and what they like to do before telling them exactly what to do in a lot of cases.
I see. So it doesn't matter if they come in with like shoulder impingement or low back pain or say foot pain. In all of those cases, from the holistic viewpoint or the biopsychosocial viewpoint, you're going to talk to them about what do you like to do and then base your treatment around that, as opposed to like a strict protocol, like fixing a car.
Yeah. Like when you fix a car, you go to the mechanic, you want to know that, well, usually there's only one thing wrong with your car when you fix a car. They're going to diagnose the one exact problem and work on that part in isolation. A lot of problems that with pain are complex. There's many, many, many things involved. The way people think about it, the way their general lifestyle's involved. So you don't want to you probably aren't just going to go at one isolated thing. So you need to learn more about the person as a whole and work in that context.
Okay. Yeah. And I've heard you mention wicked problems before. What do you mean by that?
Wicked problems is, well, this is a term from complexity science. Complexity science is a branch of science that studies complex systems and kind of is very interested in the difference between like simple problems and complicated problems, or what's called complex problems. So really a kind of a complicated problem, go back to that car analogy, is fixing a car. So if you need to go to a mechanic if you want to get your car fixed. A complex problem is kind of like a complicated problem that there's lots of moving parts, but the complex problem has so many different parts that you're not going to have a mechanic be able to find out the one thing that's wrong. There's probably many things acting together that are kind of coming together and creating the problem. So a complex problem would be something like, how do you motivate yourself to exercise more? Or how do you motivate yourself to eat a good diet? There's not any one factor that's causing that problem. Now, just because there's lots of factors involved doesn't mean it's necessarily an incredibly difficult problem to solve. Able to solve that problem using kind of common sense principles. But a wicked problem is a kind of complex problem that's extremely, extremely, extremely resistant to being solved. So lots of kinds of obesity are very, very, very hard to solve. Even though the solution seems kind of simple, we know what it is. You have to eat less and move more. Getting that done is very, very, very difficult. There's lots of other wicked problems like in the world around us, like the problem of like political polarization in America. There's many, many, many things creating that problem. And anywhere you intervene in the system to try to fix it, it might even like make the situation worse because of like backlash effects or something like that. The reason I'm saying all this is some kinds of chronic pain conditions can be in the nature of a wicked problem. So if you know, for example, that movement helps with back pain, but it hurts to move and the movement makes it worse, that can make it back pain a really hard problem to solve. Or you know that sleeping is really important to reduce your stress and to help you heal from pain, but the pain makes it hard to sleep, and then the sleep contributes to pain. This is one of the reasons why chronic pain can be a real challenge. The thing about wicked problems is they don't get fixed quickly. It takes kind of a process of evolution over a long period of time where you work on just kind of the general health of the system to get out of the problem.
I see. So it sounds like it's like kind of a multifaceted issue, whereas, you know, like say, for example, if someone comes in to deal with symptoms of whiplash, right? And you can have this idea of like, okay, well, here's a formula for dealing with whiplash, but it doesn't really help. Then there needs to be other, would you recommend that people follow that formula to help whiplash that, you know, we've been taught in physical therapy school or massage school? Or would you recommend that we automatically assume it's a multifaceted problem? So which would be?
Yeah, well, I think when you have an injury, when you've got a local tissue injury, it starts out as maybe kind of a simple problem. The problem is very located to a particular area. Certain area has been damaged. And then the relatively simple solution is you have to let that area heal. There might be some other simple mechanical things that you can do to encourage that area to heal, to take stress off of the area, and so maybe some simple mechanical things to do to kind of build the area back up if it's gotten weak, or to shift the stress to other places. However, over time, that's when the complexity of a problem can start to develop. Over time, the pain can become in the nature of a habit because you can have psychological factors start to maintain the pain, or behavioral factors start to maintain the pain. So what starts as something kind of simple can become super complex.
Mm-hmm.
So part of it depends on how long the pain, it always depends.
Yeah. Yeah. So that, and I think that's a good perspective to have, because there really isn't any one treatment for any kind of pain. And I think in the healthcare profession, a lot of us are taught to view things as like a car. You know, you need to go get a tune-up, you need to go get fixed. But there's so many complexities to this, and it seems like a lot of people do go, the injury has healed, but then they're still experiencing pain and they're still having problems, doing what they love to do. And often I know a lot of clinicians get frustrated with that because they feel like, what more can I do? When there is actually a lot more we can do besides just saying, okay, well, your pain's gone, but you don't have the quality of life that you like, or maybe the pain has moved. It seems like clinicians could still continue to work with these patients rather than just say, okay, well, we've done these treatments that follow this protocol, and so we're done.
Yeah, absolutely. I like this analogy about cars. Greg Lehman's got, he spoke at your conference a few times at your summit. He's got that good phrase about people aren't cars, they're ecologies. And what he says is they're super
That's complex. A good one.
Yeah, and I like that too, because we have a kind of a common sense about what makes an ecology healthy. People are these complex beings, and we understand people. And when we have some common sense about what generally makes them happy and healthy, and what the kind of things that can get them more active, the way to get more sleep, eat a better diet, become generally healthy. And so we have to kind of apply that common sense with our clients and kind of work with them on that kind of common sense human level that we've all got some understanding of human psychology. And you don't have to be a psychologist to kind of talk about the things that are making people, fearful of doing a certain workout, or the things that would motivate them to do something would be helpful for them. And I think we can get discouraged if we find someone's problem and we can't fix it in the same way that a car mechanic fixes a problem with a car. This is kind of what we learned in school. This is why a lot of people got attracted to the idea of helping people with pain in the first place. Just the last one? I'll kind of start backwards a little bit. I think we get really excited about, the thing that gets a lot of people attracted to being a massage therapist or physical therapist in the first place is the idea of you want to help people with pain. And it's very exciting that they can be fixed, and you can do an objective assessment to figure out exactly what's wrong, and then a really precise correction to fix that problem, like the way a car mechanic fixes a car. That works out sometimes, but we're finding out with more research is that doesn't happen as often as we would hope. When it doesn't, you shift into the more kind of person-centered human level where you're kind of applying comments and working on general health as opposed to these really specific targeted issues.
Mm-hmm. And I think there's a truth to that because I think as humans, we're so used to having formulas for things and rules and structure. So it seems like we should be able to follow this structure, follow this formula. Especially when you're looking at, I was a big follower of Sarman and, the firing patterns, and you do all this stuff. And, but that doesn't really address the person in a holistic way. And I like that you touched on about psychology, because I do hear that a lot, on social media, where physical therapists and massage therapists feel like that when you want to talk to the patient about helping them move, finding out their lifestyle, that's psychology, when it's not really psychology.
Right.
It just seems like basic human compassion, almost like you're concerned about their lifestyle and all that stuff.
Yeah.
Without telling them,
you want to apply it's not psychotherapy. It's just relating to someone on the person level. We all know how to do that. But you want to apply the principles of science to solve problems. We've seen how incredibly effective it is in so many other areas. So you want to get scientific, but that means you have to measure things objectively. So you're necessarily going to kind of have to turn your attention away from the things that are more nebulous and squishy and not so easily measured, like how someone's feeling about something, or their motivation, or the psychosocial issues that we're finding out are so important. If you want to get all sciencey, you tend to focus on the stuff that's easily measured, like, the goniometer to measure range of motion, dynamometer to measure force, or something like that. Those things are important, but you can start to, it's almost like the drunk who looks for the keys under the light post because the light is better there. The light's always better.
That's a good one.
Yeah, so the light's always better when you're looking at objectively measurable stuff. The light's not so good when you're trying to figure out how someone feels about something. Mm-hmm. And it's kind of a different skill set. It's not something you need to be a psychologist to do. It's just something that you need to practice in the clinic.
And it sounds like listening would be a good a quality for a clinician to have, because I found when I was doing massage therapy that often just listening and then repeating back what was heard in a way that let them know I was listening, sometimes it seemed like that was 50% of them getting better almost.
Yeah. And we've heard from a lot of people that have spoken at your summit, the people in pain, the patient experiences, that they say they'd gone through many, many practitioners and almost years of having pain, and no one had done that. And when someone finally did it, it was a very powerful experience, and it helped them.
Mm-hmm. So I have I'm just curious about something, how you would handle something. And I know it might be, it depends, but I'm going to try and be a little specific. So, but, say you have a client who comes in, or a patient, and say they're an avid runner, and they've been experiencing pain that prevents them from running, and they're slowly getting better, but they can't run. And as you know, because you're extremely athletic, that when people are very athletic and they can't do that sport that they love, they get very frustrated. They start to feel like they're getting fat. They start to feel like they're like boxed in. but sometimes it can be it can be tough to like, how do you help them find a different activity that they can do, to replace that so that they can still keep moving?
Yeah. Yeah. Well, it's kind of, your identity starts to form around that activity. It's a really big part of your self-esteem or the meaning in your life. And it's very, very important to people. And, the first thing I do with people is they might have already been told, hey, you got to give up the running, man. You've got the knees of a 70-year-old, something like that. And I'm kind of like, at first, I want to show them that I'm on your side and I believe in you. And I know it's important to you to get running again. Let's get you back running. If it really seems like it's impossible, then maybe it's time to start having a hard conversation with them about something, about being realistic. But, I'm going to make sure that they try it. I mean, I've had some of my best success stories with clients where people really like to run, really like to walk, something like that. Some well-meaning but idiotic doctor said, you've got the knees of a 70-year-old, you got to stop doing that. And she was convinced. And so I was like, hey, he said something about your knee. I haven't looked at an MRI of your knee, but I know that people with bad-looking MRIs on the knee can sometimes be very active and do lots of stuff. Why don't we try an experiment where you get back to doing this hiking at a low level and convince yourself it's safe to do at the really low level, and then progress it a little bit. And then if you still feel good, I'm sure that's a safe and good thing for you to do. That was a big success I had with this woman getting back to something that she wanted to do. But if you've got the person, which really to address your question, has really gone through this experiment and tried over and over and over again and failed and failed and failed, then you can talk through with them kind of the issues, these exact issues. I mean, what would it feel like to try something new, something different that you're not that good at? I think a lot of people can get a lot of benefit and meaning from other kinds of activities that they're not good at, if they're just willing to kind of accept the idea that you don't always have to be really good at something. I mean, it's hard for me, I know, as an athlete, to go do something that I suck at, but I try to be open to the possibility of doing it,
Yeah, it sounds like you're good at a lot. And
I'm okay, I'm not
ping pong. But yeah, that was interesting that you touched on, when someone comes from, say, someone's going to physical therapy or massage therapy, and they're coming from their physician, who it is against, it is, considered unprofessional to say, the physician's wrong, the physician's incorrect. And they come to you with that fear. Oh, he says I've got bone on bone, but I can still walk 10 miles. I think that's where maybe a little bit more of the listening and then understanding how to communicate, but yet not do psychology and not go above what the physician has said. Do you have any thoughts about touching on that a little bit, even though it's not directly related to moving?
Well, I definitely know the feeling of people coming to me with an opinion from someone in a white coat. And I really am very hesitant to, pull out a bunch of research and say, aha, they're wrong about this or something like that. And I think you have to be really careful about that type of thing, even if I really am sure that the physician was wrong about something. But it just kind of goes to this same theme that we've been talking about, that, being able to talk with someone and understand where they're coming from, and kind of like tune into these nuances of like what they think is an authority and what they think is not an authority. Those things are really important in ultimately determining how someone gets moving or not.
Yeah, whether they're listening to you. And yeah, another thing too, when I had my practice, was I noticed that if the client did not have respect for you, I think Maxie Mitchak said that at the last summit, if the client, if you don't have that, what was it called? Like the client relationship or patient relationship, that trust, if you don't have that first, nothing you say is going to matter. I can't remember there's a word for it.
Yeah. Well, I agree with that. You're not going to, I mean, what you're asking of someone, I mean, the best thing you could do with someone is to change a lifestyle habit. That's really hard to do. It takes a lot of time and commitment for them to be able to do that. You're not going to be able to get someone to do that or encourage someone to do that unless you have a good relationship that's based on some kind of trust. And that kind of depends a little bit on, it's different with each person that walks in. Occasionally I have people that come in and have read my a book and are kind of like, oh, well, they already trust me, and they're like, just tell me what to do. But most people come in and, I'm just some guy, and my word means nothing until I've kind of like talked with them for a while and listened to what they have to say and kind of showed some understanding for where they're at.
Mm-hmm. Yeah. And I'm really interested in, and I don't mean to turn the discussion on you, but I'm really interested in how movement has affected your life, and how you have, you've created these two really good books about movement and really broken it down. Is there like a quintessential piece of what has been the most like aha to you about movement in all these decades that you've been studying and writing about it and practicing as a clinician?
Yeah, I don't know if I can point to any kind of one aha thing. I've just it's always been part of my life. When I was, really young, I was doing a lot of team sports. And so it was just a big part of like the culture of my town or my family. And then as I got older, probably in my 20s, for the first time, there was kind of an aha doing kind of a mind-body type thing, which I'd never done before, because sports is just like beat the other guy and it's fun, but it's not like a contemplative, mind body type thing. But, I got into yoga, and, Pilates is a little bit like that. And then I was exposed to kind of gym culture, like kettlebell kind of stuff, corrective exercise, Gray Cook, functional training kind of stuff. And also fooled around with kind of a barbell kind of culture through like CrossFit. And I get something out of a lot of these. And once I realized I had kind of a general interest in the subject, I kind of pay attention to what the dancers say, even though I haven't done that much dance, and what the martial artists have to say, even though I haven't done that much martial arts, because they're all kind of talking around the same basic thing, which is how to move better and feel better, and also how to kind of build your self-image and develop kind of psychological health around a movement practice. They all have their different language for talking about it, but they're all kind of talking about the same thing. And I like to kind of be able to cross-translate between the different disciplines.
Mm-hmm. So it was that cross-translating that was probably the biggest kind of aha moment, or one of the more important things that you learned?
Yeah. I think when I got into, the neuroscience of motor control, and especially the work of Lorimer Moseley and talking about pain science, and then kind of the theories of Feldenkrais, I was kind of like, this is kind of a universal model, not universal, but it's a model that explains a lot of what these different people are talking about in their own kind of parochial tradition-based language. And this is kind of the language I'll use for me to kind of translate back and forth between what these different people are saying. There's a lot of people talking about the relationship between mind and body, meditation tradition, martial arts tradition, different language, same basic idea, I think.
Mm-hmm. So something you said earlier made me think about, when in my early years as a massage therapist, my later years, I became more mature in how I handled my clients and everything. But in my earlier years, I had prejudices against certain types of activities. So like, for example, I was seeing a lot of injuries with CrossFit, or I was seeing a lot of injuries with big group yoga classes. And so if I had a client mention that, I would say, well, why don't you try this instead? And that really isn't appropriate. So what would be something you might say to a clinician who also has those same prejudices? Because it really is about, what does the patient or client enjoy doing? What makes them feel good that they're not getting
meaningful to them. Yeah. It's what's meaningful to the person is very, very important. Mm-hmm. That's going to motivate them to do exercise. I think there's another Greg Lehman quote that I like. He's a movement optimist, which I think means that he's in favor of all kinds of movement. There's been a lot of, I think, damaging work done by a lot of well-meaning people kind of pathologizing a lot of normal, healthy movements. You can see this all over the internet. People, anytime anyone says, hey, I've got this great exercise system, look at this, you can make sure that a bunch of trolls will post and say, that's unsafe, that's stupid, it's not as good as this system, or something like that. And I think the more enlightened view is, hey, these are all good. We're all part of the get people moving team. Movement's good, it's healthy. The evidence says that, that the health benefits of exercise can be got with many, 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 many different methods. So I think the idea that movement and exercise and physical activity are good should be the default position. Also, the idea of people doing something that's meaningful to them should be, there should be more weight attached to that. So you want to be respectful of that when someone comes in. And if they're doing something really stupid, you want to get them to stop doing that, but you need to understand if it's really meaningful to them, they're probably not going to stop.
Yeah, so I think as Greg Lemon has also said in his last presentation, which I think was in 2017, if they say, oh, it hurts when I bend this way, don't bend that way, bend the other way, something like that.
Yeah, that's the kind of common sense aspect of this that I've been talking about.
So I think in that case, it sounds like that as from the clinician standpoint, it is important for us to take a look at our own biases and, to avoid preventing somebody from doing an activity that they love, because what we say is pretty powerful. So if we're like, don't do CrossFit. Everyone I know was injured doing CrossFit. I've been injured doing CrossFit, so don't do it. I mean, that can be pretty harmful. So I think it is a good idea for us to take a look at our views on those things.
Yeah. I'm getting it. You're in it. Can you hear me?
Yeah, I can hear you.
Okay. Yeah. Well, with the CrossFit thing, I mean, and you know what? You don't have to come right in there and saying what you're doing is dumb and dangerous. You can just have people tell their story and kind of like they can make the connection. It's like, so, okay, so your shoulder's hurting, you're doing CrossFit, tell me your story. And as they start, like, if it's really obvious that they're doing something that's bad for them, as they're telling their story, they'll start to put two and two together, or there's a good chance they kind of know it. They might say something like, yeah, I know I do too much. And, you can kind of like do a, how's that working out for you type of a thing. And, as long as it's their decision, if they really love this is what they want to do, and they know the consequences, you can, if they have some suspicion that this is what's causing their problem, I think that probably is contributing to your problem. It's your decision whether to continue, though. And you make sure it's their decision. And usually, well, not always, but, you'll increase the chance of them making the right decision, I think, with that more open-ended motivational interviewing type of thing by telling someone don't do it.
Yeah. And I've actually seen that when I've had clients come in, say, for example, I had someone come in with a lot of, she had problems with her moving shoulder rotation. And just by talking to her, she loves sweeping and cleaning her windows like every week. And she had her house was loaded with windows. And she's like, I just love cleaning my windows. Do you think that's causing my, so yeah, it's fun to kind of watch them as they talk. They'll figure that out a lot of times.
Yeah.
Or like you said, you can kind of guide them, but as you pointed out, it is very important that they feel like it's their idea and that they, come up with it.
Yeah.
So, in your experience, Todd, can you share some of the more creative ways that you've helped patients get better? Like, say, for example, so I was listening to your presentation in 2016 at the San Diego Pain Summit, and I was listening to some of the questions, and one of them was from, I believe, Cara Barnett, and she said that she runs a pain management program at Kaiser, and one of her patients had problems with body awareness. And so she had them imagine themselves from the back and like draw what they look like from the back. And I thought that was, so I was wondering if you've ever done anything like that with your clients, just really unique ways of getting them to look at moving or look at themselves that you could share that, the listeners could take idea from.
Yeah, like some sort of genius, amazing thing I came up with right on the
Yeah,
spot.
and it doesn't even have to be genius, but just something where it was
Yeah.
just like such a far out thing that you would have never thought of, but for some reason you did, and it interestingly helped. Or
Yeah, I don't know if anything's coming to mind. Maybe I'm not all that creative. But one thing I'm always doing is kind of like you mentioned, the kind of like that body mind imagining yourself from behind type of a thing. I could see recommending that type of a thing to a person if they've already kind of previously expressed an interest in kind of body mind, body perception kind of stuff. Maybe they're a meditator, maybe they're a yoga person or something like that. So I try to know at least a little bit about these different traditions, and I ask what people are doing within their tradition. If they're kind of like a body mind person, we might start geeking out about that type of a thing, and then I might recommend some sort of a way to modify what they're doing, or change it a little bit. But I really kind of think in terms of very marginal improvements for everyone. I'm not ever really looking for a revolution. I'm looking for, what, just one step in whatever, in the right direction from whatever place they're in.
And it depends, as you said. That makes a lot of sense, that if they don't already have experience meditating, that type of thing is just not going to make any sense to them. So really, again, back to listening.
Right.
And then what is their experience with movement, and then using that experience to help them along. That sounds like what you're talking about.
Yeah, because people have wildly different interests, and their different levels of response to things. Like I do Feldenkrais method. That's like people rolling around on the floor really, really slow in a kind of a Tai Chi way. Now, some people that's really cool. They love it. They get a high response to it. There's a definite subset of people, and it might even be in the majority of people, that don't understand why other people are doing it, don't like it, and don't respond to it. So you really kind of have to. So I think there's a very wide range of normal when it comes to people's interest in doing movement style practices.
And so, in your experience with, just being, of course, I don't know how active you are on social media, but just either social media or in your discussions with other clinicians, what is something that you see that's really lacking right now in our current, especially in the physical therapy, world? What do you see that's lacking as far as movement's concerned? Like maybe some advice you could give, or if you could speak to that at all.
Yeah, I think it depends on what population you're talking with. I kind of, when I'm online and talking to, I talk to a lot of physical therapists and manual therapists online, and that's kind of a self-selected group of people that are kind of already interested in this point of view that we're putting forth anyway. So it seems like everyone's kind of already on my page, but I'm sure if I was kind of tuned into the larger group of physical therapists, I'd realize a lot of them do have this kind of mechanical, looking at the body as a machine and them as a car mechanic type of an attitude. And I think that's one of the biggest things that I think could be modified for the better.
Yeah. And then finally, because I guess I think it's been probably about 40 minutes. This can be edited out if not.
Yeah,
I don't know.
like
So finally, I wanted to ask you, just for the people who are listening, who are going back to work, whether it be manual therapy, physical therapy, whatever, they're going back to work tomorrow, or they're starting, Monday, if it's this, they're listening on their weekend. What is an actionable piece of information that you could give them that they could go ahead and start using right now in the clinic when they go back to work?
I think what you just said about a little bit more listening, a little bit more patient history, a little bit less telling people, a little bit more letting stuff emerge, a little bit less directive, a little bit more understanding that if anything positive is going to happen in their movement lifestyle, it's really going to come from them. They're in charge. It's going to be more sustainable and authentic and happening if it's something that they're kind of direction that they're kind of already pointed in already. You're not going to take a big ship and steer it around in a complete opposite direction. So if you really spend time listening and figure out where they are and where they're going, I think that's the best opportunity to change them in a better direction. Thank you very much for having me.
Thanks again, Todd.